Do you know where your next meal is coming from? Over 200,000 East Tennesseans don't. That's nearly twice the capacity of Neyland Stadium. When you're that hungry, it's not always top of mind to make healthy choices, unless someone is finally able to offer them.
Food is medicine in that healthy lifestyles can really change people's lives. It was really nice that the Heart Association was able to apply for a grant to help us with getting refrigeration and freezer units that we now use to help provide better and more options to our patients.
Kappa Kitchen, part of the Knoxville Academy of Medicine's Knoxville Area Project Access Program, is one of over 30 food pantries in the Knoxville area working with the American Heart Association's Community Impact Team.
We're really educating and empowering our community to take better care of their health.
We have people with heart issues pretty predominant in East Tennessee, and we need to do whatever we can to decrease that. And this allows us to impact that on an individual basis.
A balanced diet improves heart health and other cardiovascular risk factors like high blood pressure.
It's called the silent killer for a reason. You just don't know when you're having problems, so you really need to screen for it.
Interfaith Health Center, along with Kappa Kitchen, are two groups utilizing both food pantries and self-check blood pressure monitor distribution, helping those they serve know the realities of their own heart health.
Not only are we helping the patients to monitor their blood pressure at home, it's also improved our clinical practices as far as standardizing our blood pressure cuffs, making sure that we're adhering to all of the standards of care.
Interfaith Health Center is the only clinic in East Tennessee to be nationally recognized for its commitment to improve cardiovascular health through the American Heart Association's Target BP program.
Quite often we see patients who have not had access to health care for up to decades. They actually have significant hypertension or diabetes, and so we're appreciative to the American Heart Association for now giving us tools to help these patients, once they've been diagnosed, to manage their chronic conditions much better.
Knowing your numbers and having access to nutritious foods can impact your heart health across a lifetime.
Thanks to the American Heart Association, we are able to provide more and better health care to our patients, and better foods, and a better lifestyle.
All of our research and all of the information that we're sharing out in the community comes from a trusted source. We come in to enhance the work that's already being done, and I think that's boosting trust in patients coming in and having better conversations, diving in deeper to their health and understanding what choices they may be making now that they are learning through going to Kappa Kitchen or going to Interfaith Health Center, and they're learning why these choices on the daily can really course correct some of the chronic illnesses that are affecting their hearts and minds.
The American Heart Association is here to help our neighbors help themselves. The more support we can gather, the bigger difference we can make.
Without access to additional funds, we're limited with how many places can get cold refrigeration, how many people can get access to validated blood pressure cuffs, and how many more places can be seen as a heart healthy hub no matter what service they're providing to the community.